Hello everyone and welcome. Today we're going to tackle a very, very important topic, something you'll see again and again in your careers. We're talking about the battle against chronic viral hepatitis. So let's jump right into the heart of how we fight these incredibly persistent infections.
Now, before we get into the specific drugs, I want you to think about this. How do you fight an enemy that doesn't just visit, but moves into your house and plans to stay forever? That's what we're dealing with here. These are not your simple common cold viruses that come and go. These are long-term invaders, especially of the liver. So the real question for us as doctors is, how do we kick them out? Or at the very least, how do we stop them from completely wrecking the place? This is our central challenge today.
All right, so here's our game plan for today. First, we'll look at hepatitis B, where the strategy is all about control. Then, we'll move on to the absolutely amazing story of hepatitis C, where we're actually talking about a cure. We'll check out the revolutionary new drugs that made this all possible, and finally, we'll wrap it all up with the key things you need to remember. Cello, let's begin.
Okay, first up, hepatitis B, or HBV. Now listen carefully, this is very important. The main goal here isn't always to completely wipe it out. No, the goal is lifelong suppression. Why, you ask? It's simple. If this virus keeps replicating uncontrollably, it causes nonstop inflammation, which leads to cirrhosis and then liver cancer. So our job is to put the brakes on its replication hard. We want to lock it down for good and prevent all that liver damage. This is a crucial distinction, as you're about to see.
So, how do we put those brakes on? Well, the secret is to attack the virus's own machinery. You see, hepatitis B has this special enzyme called HBV DNA polymerase. Just think of it like the virus's personal Xerox machine, a super-fast copy machine that's just churning out copies of its genetic material again and again and again. Our entire strategy is to throw a spanner in the works of this very machine.
And how exactly do we jam that machine? It's actually quite brilliant. Our drugs are basically fakes. They're what we call nucleoside or nucleotide analogs, and they look exactly like the real building blocks of DNA. The virus's copy machine, the polymerase, it's not very clever. It gets fooled. It grabs one of our drug molecules and tries to add it to the new DNA chain. But here is the trick. It's a dead end, a faulty link. Nothing else can be added after it. The chain stops right there. Replication stops. Cold.
Okay, now for the drugs you will actually be prescribing. For hepatitis B, the two names you absolutely must remember are entecavir and tenofovir. These are our first-line choices. Why? Because they're super effective, patients tolerate them very well, and, very important, the virus finds it very hard to develop resistance against them. You might come across older drugs like adafovir or telvudine, but we don't really use them as first line anymore. They're just not as good. So for your exams, for your practice, remember these two, tenofovir and entecavir.
Right, let's change gears completely now. We're moving on to hepatitis C. And friends, this is a totally different story, a real revolution. With HBV, we were talking about managing, about controlling. With HCV, forget that. Here, the game has changed. We are not just aiming for suppression. We are aiming for a cure, a complete, total cure. We're talking about kicking the virus out of the body for good.
So what does this cure for hepatitis C actually mean in the clinic? How do we know we've won? We measure it with something called a sustained viral response, or SVR. This is the gold standard, the finish line. It means we take the patient's blood, and 6 months after they finish their treatment, we can't find a single trace of the virus's RNA. Nothing. Zero. If they hit that mark, they are considered cured. This isn't a temporary fix, people. This is one of the biggest medical victories of our time.
But you know, it wasn't always this good. For many, many years, the only weapon we had was this combination of injectable pegylated interferon and oral ribavirin. It was the standard of care, it was the best we could do, but it was a tough, tough treatment for our patients. And here's why it was so tough. Just look at this list. The side effects of interferon were brutal. Imagine telling your patient they have to endure months of feeling like they have a terrible flu every single day. Fever, fatigue, on top of that serious depression. Their blood counts would drop, some would even lose their hair. It was a long, difficult, painful journey, with no guarantee of a cure at the end of it all. But then, everything changed. The last decade has seen a complete revolution in hepatitis C treatment. This wasn't just a small step forward, it was a giant leap for medicine. Welcome everyone to the era of the direct-acting antivirals, or the DAAs.
These are the game changers. Absolutely. The old drugs like interferon, they were like non-specific. They just tried to boost the immune system and hope for the best. But DAAs, they are like laser-guided smart missiles. They were designed with incredible intelligence to seek out and disable very specific, essential parts of the hepatitis C virus itself. Precision, that's the key word.
So how do these smart missiles work? They launch a devastating three-pronged attack. First, they go after the NS5B polymerase. That's the virus's RNA copy machine. Boom, that's shut down. Second, they block the NS3 protease. Think of this like a pair of molecular scissors that the virus needs. We block those scissors. And third, they inhibit the NS5A protein. This is like the master architect for the virus. So by hitting these three critical targets all at once, we completely dismantle the virus's entire life cycle. It simply has no chance.
And here are the names of our key soldiers in this new army. For the NS5B polymerase, the cornerstone drug is sofosbuvir. For the NS3 protease scissors, we have drugs like semaprevir. And for that critical NS5A architect, we have ledapaspvir and daclitaspvir. Now, the real magic happens when we combine these drugs together in a simple, all-oral tablet regimen that is unbelievably powerful.
And the result of this strategy? Look at that number. A cure rate of over 95%. Just think about that. We went from a 50-50 chance with horrible toxic treatments to a near-certain cure. A simple course of tablets for 8 to 12 weeks with minimal side effects can now cure a disease that used to destroy livers and kill people. This is truly one of modern medicine's greatest success stories.
Okay, so let's quickly summarize. Let's pull everything together into the final key takeaways. We talked about two different viruses, HPV and HCV, and two very different strategies. And the most important thing for you to remember is this fundamental difference, suppression versus cure.
This slide sums it all up perfectly. For hepatitis B, the goal is lifelong suppression. We do this by targeting the viral DNA polymerase with drugs like tenofovir. For hepatitis C, the goal is a complete cure, or SVR. We achieve this by precisely targeting multiple viral proteins, NS3, NS5A, and NS5B with our DAAs. The approaches are fundamentally different, and it's absolutely crucial you understand this distinction.
And I want to leave you with one final thought. We can now cure hepatitis C. What does this incredible success story teach us? It shows us that if we can understand a virus's life cycle in minute detail, we can design highly specific, powerful drugs to defeat it. So the question for your generation is, how can we now apply these lessons to other chronic viral infections, like HIV, or to prepare for future viral threats? The journey of discovery is far from over. Stay curious. Thank you.